Hey everybody, Tim Alberg here, and thank you for listening to the YFP podcast, where each week we strive to inspire and encourage you on your path towards achieving financial freedom. This week I had a chance to welcome pharmacy leader, influencer, and entrepreneur Dr. Kimber Boothe to talk about her career in health systems and the pharmaceutical industry, why she founded the Kimber Boothe Group, where she helps pharmacists transform and advance practice to have a joyful, engaging career, how she has been able to monetize her expertise, and the lessons that she learned from publishing her second book, Pharmfluencers, The Inspiring Stories of Pharmacy Entrepreneurs. Before we hear from today's sponsor and then jump into the show, I recognize that many listeners may not be aware of what the team at YFP Planning does in working one-on-one with more than 240 households in 40 plus states. YFP Planning offers fee-only, high-touch financial planning that is customized for the pharmacy professional. If you're interested in learning more about how working one-on-one with a certified financial planner may help you achieve your financial goals, you can book a free discovery call at yfpplanning.com. Whether or not YFP Planning's financial planning services are a good fit for you, know that we appreciate your support of this podcast and our mission to help pharmacists achieve financial freedom. Okay, let's hear from today's sponsor, and then we'll jump into my interview with Kimber Boothe. This week's podcast episode is brought to you by Insuring Income. Insuring Income is your source for all things term life insurance and own occupation disability insurance. Insuring Income has a relationship with America's top-rated term life insurance and disability insurance companies, so pharmacists like you can easily find the best solutions for your personal situation. To better serve you, Insuring Income reviews all applicable carriers in the marketplace for your desired coverage, supports clients in all 50 states, and makes sure all of your questions get answered. To get quotes and apply for term life or disability insurance, see sample contracts from disability carriers, or learn more about these topics, visit insuringincome.com/your financial pharmacist. Again, that's insuringincome.com/your financial pharmacist. Kimber, welcome to the show.
Thank you, Tim. It's great to be here.
So excited to have the opportunity to talk with you. And before we do a deep dive into the work that you're doing today and much of your entrepreneurial journey as of late, talk to us about the path of your work into pharmacy, where that began, your interest in the profession, as well as your career journey as a clinical specialist in industry and then as a health system leader.
Thank you, Tim. Well, I just first of all want to say, that I do love our profession of pharmacy. And I think I want to thank you for everything you're doing to support our profession's financial health and support our innovation. I have had a wonderful career in pharmacy, starting mostly in hospitals and health systems in various clinical roles and as a cardiology specialist, moving up to leadership roles, ultimately into being a system director, chief pharmacy officer for a community health system, as well as being a system director of clinical services for an academic health system. I also did spend 10 years in the pharma industry, so I had that experience, which I actually do owe a lot of my innovation and business savvy to the development I had in the pharma industry, where I did various roles in the medical affairs department. But I was definitely drawn back to health systems, to what I refer to these days as my intrapreneurship activities, where I was, promoting innovative practice, bold strategic planning to advance pharmacy within an organization such as health systems.
Kimber, I want to dive a little bit deeper on that because I think there's a lot of glorification that's going on in entrepreneurship right now. We use that term a lot, and I think sometimes that can be interpreted as being synonymous with you own your own business or you start your own business. But intrapreneurship is a term we're starting to see grow, and I'm grateful for that. And I think in the profession, that term I actually like a little bit more because I think it's something that everyone can resonate with regardless of their role and the impact that they can have on the profession. So define for a moment what you mean by intrapreneurship. And obviously, I think that's something that we're seeing, lots of folks have opportunities within the profession that could be independent of owning their own business, right?
Absolutely. And, at the end of the day, entrepreneurship is wonderful. And I know we'll probably talk more about that as well later on in this conversation, as I am now what I like to call a full-time entrepreneur. But at the end of the day, most people are not going to be entrepreneurs. When you look at our total profession, 350,000 pharmacists in the US, intrapreneurship is that opportunity to be innovative at work within the safety and support of an organization. So it is referred sometimes to as an entrepreneur on the job or an entrepreneur, in an organization. So it's basically that ability to do innovative things, but within that support where you have additional financial support. You don't necessarily have the risk of having your own business. That company is taking the risk. But there's definitely some challenges because I know there are some organizations that are not open to these innovative ideas, and you may not be able to implement something that you're trying to do. But definitely the most successful organizations out there, whether they're in healthcare or external to healthcare, those that allow for entrepreneurship to occur within their organization are more successful. So allowing the employees, team members to come up with ideas, allowing them time to work on those ideas while in the organization helps their bottom line, helps them to be more successful and ultimately to create more revenue for the company.
Yeah, and I think that's a great point. I mean, yes, it increases, the bottom line, increases the revenue, hopefully pushes the innovation. I would argue also for the employee, having that autonomy, having that space for creativity also probably ties to things like satisfaction in the workplace and retention, and obviously can have a positive impact for employers as well if they're able to create that space to allow for entrepreneurship. Kimber, your motto is pharmacy can do more with more. What do you mean by that?
Well, I have to admit that definitely is my motto. And while there's definitely times that we need to find efficiencies, I get very upset when I hear that phrase, do more with less. And yes, again, there's times we can find efficiencies, use technology, and be able to do more. But what I've seen in our profession is that we are underutilized and under-resourced for all of the massive amounts of unmet medication and health-related needs out there. And so when I actually, returned to health systems after my 10 years in pharma and realized that the health system I was working at had grown immensely in terms of the number of patients, the number of services being provided, but the pharmacy team had really not grown in the same ratio. And what I recognize is that we could be doing so much more, but we only had enough resources to focus on like the most acute problems. And whether that was on the acute care hospital side or even in the ambulatory space where we had very few ambulatory pharmacists helping patients on an ongoing basis. So I came up with that motto and it's definitely stuck with me. And it's really my mission and really why I left my intrapreneurship role to do entrepreneurship, because my goal is to help create 100 new positions every year in pharmacy. And when I think about some of the concerns that there's too many pharmacy students graduating, well, when I look at the data and you really look at the unmet needs of complex medications, aging populations, physician shortages, I see a huge need for pharmacists. And while I don't know the exact number of pharmacists we definitely need more pharmacists practicing, but in different places than we are today. And also with different and better reimbursement models that value our overall benefit to healthcare. And what I often refer to as the quadruple aim, that we can help with improving the quality, of care. We can improve the patient experience. We can improve provider satisfaction and ultimately reduce costs by having more pharmacy team members. And the last thing I'll say about it is I often do, the reason I say pharmacy can do more, not just pharmacists, is I definitely see a huge value of our pharmacy technician team members and have definitely advocated for increasing their roles and as part of a true career for them, as well as, of course, integrating our students and optimizing more roles or creating more resident positions. So that's why I often say pharmacy can do more with more, not just pharmacists.
Yeah, I love, Kimber, your vision and an abundance mindset of creating new positions, right? 100 new positions in pharmacy each year. I wish we would see that adoption, at a greater level, among our national organizations and others, because I think it really gets out of the conversation of, we only have so many jobs and this many graduates. And what are we going to do? How do we increase the pie, right? How do we increase the pie and the opportunities that are out there, which requires, what we were just talking about a moment ago, kind of that culture and spirit of entrepreneurship and entrepreneurship. And so talk to us about the genesis of the Kimber Boothe Group. So your business, and we'll talk more about products and services here in a moment, but the Kimber Boothe Group, What problems or challenges did you face? What were you trying to remedy with this business?
Well, it's interesting. And when I first started the business really 8 years ago, definitely as a side hustle, like maybe many of your listeners
Mm-hmm.
are doing or considering doing. So at the time, actually, when I started, I was actually still in pharma at that time. And definitely, I had had multiple business ideas that all kind of ended up in a file cabinet. And so there was definitely a bug that I had around entrepreneurship, but hadn't found the right fit for me until I actually came across this thought leader influencer model of an
Mm-hmm.
expert, where it took away some of the what I saw as barriers to a business, like physical space, products. And it became about, what are you good at? What do people come to you for? Like, right? Like, what are you the expert in? And how can you monetize that knowledge by sharing it with other people and helping them to grow and becoming
Mm-hmm.
like that multiplier to spread? And so when I came across this experts model, that's when I decided actually to create my business. I came up with a list of the things, again, that people naturally came to me for, the things that I was drawn to learning more about. And it was definitely a lot about strategic planning, project management, and career development were kind of the three main areas, both career development in terms of your professional development, but also, being more assertive about your career trajectory and path.
Mm-hmm.
And so that's how I started. It was very general. And I started to do some things on the side, some coaching. I always like to refer back to my first coaching client was a opera singing soccer mom who just wanted some help to get back into opera singing and
That's
into the
cool.
stage where she had focused on her family for so long, and we worked through that, and she got on stage, and so she was my first coaching client. And from there, it was a few years later that I actually went to the Metapreneurs Conference, which is
Mm-hmm.
an event that a few pharmacists had created. Anna Garrett, Sue Paul, and Michelle Fritsch created that event. And when I went to that event, I realized there that, my passion is pharmacy. And that is where I had, definitely some success with doing some intrapreneurship business plans, justifying more positions. I was being asked to speak by various, organizations, conferences, and I said, why am I trying to do this business very broad? I should be niching down or, kind of focusing my target to pharmacy, because I don't mind helping, soccer moms and things like that. But really my passion is pharmacy. And
Mm-hmm.
what I really wanted to do and connect those dots together was to really focusing on helping the pharmacy profession to advance, through sharing, again, similar topics, strategic planning, project
Mm-hmm.
management, and career development were definitely a big part of that. So back then is when I created my Pharmavation course, which then turned into my Pharmavation book and the Pharmavation consulting that I do for health systems, which is where I spend most of my time these days, is actually helping organizations to write strategic plans, write those business plans that actually, justify those
Mm-hmm.
additional positions.
And for folks that are, interested in learning more about what Kimber had shared of the influencer expert business model, she talks about it in her book, Pharmfluencers, The Inspiring Stories of Pharmacy Entrepreneurs. So more information there. I think that's a great way for pharmacists to think about, especially what, Kimber, when I think about your career journey and the expertise that you have, and I suspect many of the relationships in the network that you have, it makes a whole lot of sense that you're doing, some of that consulting. And if I heard you correctly, you're doing both on the business to business side. So you're consulting with health systems and organizations, helping them on a strategy leadership level. But then also you have a suite of services that are really on the business to consumer, the B2C side for the individual, being the courses, the coaching, and the books. Is that correct?
Exactly. Yeah. So I have like what I call like my product matrix of what I'm trying to support people with. And yeah, there's definitely the consulting arm that focuses more on the businesses themselves. So I'm
Mm-hmm.
usually paid by, director of pharmacy, usually. And then others where it's individual coaching, online courses or membership programs where people have opportunities for all of us to connect in a smaller
Hmm.
group coaching atmosphere, both on the entrepreneurship side and the intrapreneurship side.
And could you break down a little bit further, Kimber? You said you spent a vast majority of your time in the consulting with the health systems. Roughly speaking, certainly don't have to share, individual numbers, but roughly speaking on time spent or revenue of the business, if we think about this as a pie chart with your consulting to organizations and then some of the coaching and the coursework that you're doing with individuals or smaller groups, as well as like the books or other products, like how would you break that down in terms of the different products and services that are within your business?
Yeah, that's a very good question in terms of that breakdown and what it is now and what I want it to be. I'll share here.
Hmm.
So right now it is more like 90% of my time and 90% of my revenue is coming from consulting.
Okay.
So that is that work. And the other 10% is coming from the memberships, one-on-one coaching, and other things like the summit programs that I've done. And so that 90-10 ratio, I'm definitely wanting to change that a little bit. I'm doing things like I have a full-time assistant, and we're trying to grow the online business through the membership, basically just because my time is limited. And if I want to be able to have more impact and reach more people, it's not going to be through my one-on-one consulting. So I think the goal would be to grow that about to 40% of the business, 50 to 60% maintaining on the consulting side, because I still think that's vital for me, having that integrated involvement with organizations is really helpful for me to grow and for me to really have the biggest impact. But I also know, again, to reach more people and to get other people to write their own business plans so that we can create even more than 100 positions a year is definitely how I want to grow. So again, moving towards more of almost a 50-50, but in this current year, my goal is to get to at least like 80-20. So each year I have a goal to move that needle about 10%. And again, some of that is through growing my group membership that I have called the Connector Leadership Circle. So again, that I can help more people at once than I can through, one-on-one coaching conversations or one-to-business consulting. I will share my other goal with growing is to add to my team. And so I'm definitely talking with folks about doing some consulting with me, so I could potentially take on more consulting clients if I had a team. Right now, it is just a team of one right now. And while I have been asked by other consulting companies to become part of their firms, I've chosen to stay on my own because of the flexibility, so I could focus on what I want with this ratio of services. But again, I recognize that organizations do need help. And when I'm full on my consulting or my coaching clients and I can't take any more, well, how can I serve more? And that would be adding to my team and them coming under the Kimber Boothe Group to do the consulting, with me, and as well as the potentially some additional coaches. But I do recognize that, people do come to me, for my knowledge, but there's a lot of people who have learned from me over the years and can teach and do what I'm doing.
Yeah.
So it doesn't have to be just about me. And I think the last thing I'll just share with that is when it comes to having a business, my current business coach, which of course I've always recommended having a coach, throughout my career. I've either paid for myself or advocated through my organizations to have a coach. And my current coach is definitely very focused business. And what they say in that program, it's called Action Coach. And they follow a very organized format for business owners. But their definition of a business owner is owning a business that can operate independently of you. Yep. And so Amen. I definitely am not there yet. And I don't know that I'll ever, want it to be that way. But if I want to leave a long-lasting legacy, that is why I am exploring, with my coach, what are these ways through adding to my consulting team or adding additional coaches, creating this membership programs where I can reach more people and it can become a little more independent. So that is my goal. I don't think I ever started that way, though. I mean, honestly, that definition and that thought process is still pretty new, because when I did think of this thought leader model, and when I did even think about, what to call my business, I called it my name, because a lot of the people I was learning from back then, that's what they did. And then their products, so I brand my products and services and trademark them, but the business itself was me. But in this new mindset, it won't be me in the future at some point, or it definitely will be a team. That is why it says group, not just Kimber Boothe. So that is part of that. So thanks
That's
for letting me
great.
share those thoughts.
No, I'm glad you did, because one of the things I always encourage folks is they, have an idea that they're passionate about and they want to pursue, or they say, hey, I want to start my own business. One of the things I'll ask and encourage them is like, what's the goal? Like, what do you want this to look like? Not only what is the vision of that product or that service, but, if we fast forward 20 to 30 to 40 years, is this a lifestyle business? Are you a solo entrepreneur? Do we envision a model where, as you mentioned, Kimber, by definition of, sounds like what the Action Coach program does, that, this can operate without you and therefore, live on without you, which makes a whole lot of sense when you talk about this vision of really impacting and leaving a dent in the profession and growing positions. Like, scalability makes a whole lot of sense, right? Because there goes the impact that you can have. And that could mean beyond your career, that could mean time off that you have, but that other folks are helping to advance that mission. And that's part of a couple of reasons why I wanted to dig in a little bit of, behind the curtain of the business. Is one, I suspect that, we may have many listening that say, hey, I'm really interested in learning more about what Kimber is doing. And you can find all this at kimberboothe.com. We'll link to that in the show notes. But number two is that I don't think we often share enough of among pharmacy entrepreneurs of like, what does the actual bones of the business look like today, and where do we want it to go? And I think that's so helpful, because for many people that are, at the different phases of, hey, I've got an idea, or it's a side hustle, or I'm actually starting to validate an idea and grow it and scale it, being able to hear, even if someone isn't thinking about a model that fits necessarily within, the realm of what you're doing, I think it's helpful to hear other models that exist, how those businesses are monetized, what are some of the challenges, and where do they envision the growth going in the future. So my follow-up question with that in mind, Kimber, is, as you have this business that has both a B2B, so business to business, working with health system organizations consulting, as well as a B2C, where you're doing individual types of coaching and programs and books, do you see synergy between the two? So as you talk about your services, I could see where you're consulting with an organization, and leaders within that organization may say, hey, I want some coaching or services individually for me, or vice versa, where individuals are engaging with your products as an individual, as a consumer, and they say, hey, we really would love to have Kimber be a part of our organization. Do you see some of that crossover that's happening?
Yes, definitely. There's crossover on the B2B and the B2C where, I think both ways. So definitely where I've, been brought in as a consultant, and then, they say, oh, I want to join your membership to have this, you can finish your consulting project, but now I want to stay involved, either themselves or they want it for their team members. And so they'll have them join the membership, or, attend my summits, buy my books. But also on the other side, definitely I've worked with people as one-on-one coaches, and then they say, oh, this is great, we've gotten this far, but, it would really help if you could come in and work with us, directly. So I'm going to suggest you be a consultant. And I definitely have started, I do plan to look into this further, is also, trying to get these organizations as part of a bulk purchase. So, can they, as part of their professional development of their team members, they pay for it. So rather than many times the individual is paying for some of my services and products, would the health system or pharmacy pay for their members to go. So I have, group rates, again, that I've introduced to a few health systems, but want to offer that more broadly, where, if they have, 10 people join one of my courses or join the membership, they get 10-20% off because they have paid for it. Yeah. And then the individual, has gotten that support and recognition from the organization. So absolutely, a lot of synergy there.
I love that, Kimber. I think you and I maybe talked about this offline, a while ago, as we share some previous career paths and links in the health system pharmacy leadership world. But I think that area is so ripe for, ongoing coaching development at the pharmacy, director and management level of folks that, have found themselves in those roles through extensive training and obviously lots of professional development that got them there. And if I'm a director of pharmacy, chief pharmacy officer, I want to not only recruit and retain that top talent, but I want them to grow in their awareness of what is possible. We'll talk in a moment here about mindset. And I certainly see value that can happen as you're working with organizations also, doing some individual coaching and consulting as well. So glad to hear that, you're exploring that direction.
Well, and I think, I'll just add to that, Tim, briefly. Obviously, and you've focused a lot on the, health system pharmacy leadership with the residency programs. And it is great when people know they wanted to go into leadership and they tend to focus on that. Mm-hmm. But what I've definitely seen in pharmacy is a lot of times people are appropriate, they're very focused on their clinical knowledge and, and then they get tapped for leadership positions or they have an interest. And, it is surprising to me when I ask a group of pharmacists, like, who has a professional development plan? And like, maybe like 5 to 10% of the people will raise their hand. I've been in audiences where nobody has raised their hand. So sometimes we finish school and then we're doing continuing education, but we're not being strategic about our career development. So for me, it's all about being strategic, not just in the business plans, but being strategic about your career. And those are a lot of the folks that I help, in addition to the, health system pharmacy leadership residency trained folks who knew that they wanted to go into leadership. It's all of the other team members who weren't as interested, but because they're strong clinicians, they do get tapped, and there's a lot of a need and opportunity there for ongoing support.
You're giving me flashbacks, Kimber, of, I think everyone who's gone through residency can relate to the days. It was ResiTrack back in the day when I completed. I think it's now Pharm Academic, but, just the extensive evaluation and goal setting and professional development that happens during that training year. And then you just enter into like the wild, wild west. And, that's a common thing you hear among folks of like that transition is very stark from, development and goal setting and evaluation that's very rigorous to like it becomes much more self-initiated, unless you've got a supervisor that is very, very passionate about that. So great reminder, for folks that have gone through that training or have not, I think of how important it is to be intentional as we think about the professional development piece. Kimber, your latest book, Pharmfluencers, The Inspiring Story of Pharmacy Entrepreneurs. Folks can find that book available on Amazon. You can also go to kimberboothe.com to get more information. One of the things you say in the intro is, quote, "I know far too many pharmacists who are experiencing burnout from working within the healthcare industry, who find themselves unable to achieve the level of financial freedom they want, who believe that they can do more than what they're allowed within the confines of their job." For those that hear that are listening and say, yes, that's me, what advice would you have for them?
Well, definitely get the book. So the reason I chose to do, to get this book together is, again, I'm really, pro pharmacy. And so I want to advance the profession, whether it is through intrapreneurship or with entrepreneurs. And so this book, what's so cool about it is 34 pharmacist entrepreneurs and their inspiring stories of how they have taken their passions, their knowledge, such as yourself, as you are featured in this book, to share that of how they have created a business to monetize their knowledge and have the impact that they desire. And some people are doing it, definitely there's people in the book that are doing it as a side hustle, others that have been able to transition to it full time, like you and I. And it is just my way of helping to motivate people to know that they can do this, again, either on the side or as a full-time, career. Again, I don't think this is the only path. By all means, I do see lots of opportunity in pharmacy. I do think within our organizations, we need to be innovative about it, but I do love entrepreneurship. It's been a wonderful experience for me in terms of, being able to be having some freedom and the creativity to design a business that in some cases has more flexibility than a job. It does have more risk sometimes. And, we know there's some data that shows that small businesses don't succeed. But again, a lot of what this book focuses on is this experts model, or that's why it's the pharmacist influencers. So in this book, I really focus on like what I had said about my business. It's a slightly easier business model than others that have, lots of infrastructure. So, but what we do talk about in the book, and why I think people who are interested in or just want to understand more about businesses is, getting the book, reading the stories to be inspired. There is access to a chapter that talks about the outline of the Pharmfluencer business model, which will walk through some of the basics of starting a business and understanding some of those aspects of, why would you start a business? What type of topic do you want to focus on? And definitely we go into what I've summarized as the 14 common methods to monetize your knowledge. And this is where, somebody who, and we definitely have a lot of different entrepreneurs out there like yourself who've focused on an area. We have the prednisone pharmacist, we have the fertility pharmacist, the public health pharmacist. We have all sorts of people who are diving deep in areas to, again, share their knowledge, but also being able to monetize that. And those 14, methods, range from creating like apps and tools, writing books or ebooks, creating, online courses, doing coaching, one-on-one or group consulting, clinical services, which is a lot of what I would say when we think about some of the entrepreneurship in pharmacy these days, doing MTMs, doing fee for service, clinical services. That's still an awesome method, but that's not the only way to monetize your knowledge. You can do live seminars, create masterminds, memberships, sell just smaller PDFs. It could be, physical products like, Megan Milne, who is the prednisone pharmacist. She has a supplement for people on prednisone. You can do speaking. And while that could be potentially a money maker, it's definitely also a marketing tool. And you can also sell, webinars and even do virtual summits these days, which have become important. So those are like kind of the 14 ways that I think of to monetize your knowledge that we talk about in the book. And then each of the 34 Pharmfluencers shares what their journey is and what they're doing to monetize their knowledge. And you only have to pick one to start. So once you read the book, you're inspired, you can think through and find your ikigai, which is kind of your passion and purpose, and tie that to something that can be monetized. And you pick a method to monetize. I honestly did not start with books. Books are not necessarily my favorite thing to do. So definitely the coaching was where I started, doing that one-on-one coaching that actually has probably the lowest barrier to entry in terms of ease for supporting people right away. And then I moved on to creating the online courses and selling those. And then as you heard about some of the other methods that I am using.
And that's what I loved about the book, Kimber, is that, the 14 ways and ideas that folks can have, the buckets, if you will, of how to monetize, the work that they're doing, followed up with over 30 different pharmacist entrepreneurs and stories. And I think the passion we share for featuring pharmacist entrepreneurs and stories is the desire that I see among pharmacists that say, I'm interested in using my pharmacy degree in, maybe what we'd call a non-traditional way. And I don't know exactly where to go and how to get started. And I always say is we share more of these stories like we're sharing yours here today. Maybe for some folks, they're going to say, hey, I hear what Kimber's doing. I want to do something, like that, or it sparks an idea. But more than anything, it's that idea creation and genesis and just opening up the door of, wow, I had no idea. There's all these pharmacists that are out there that all graduated with a pharmacy degree. And now they're doing, 34 different things in the case of the individuals that are featured in the book. And so I think it helps folks to spark an idea, perhaps get them thinking a different way, but it's tangible, right? I think often you read about, hey, how can you monetize, your income or side hustle or this or that? And often folks are like, hey, that's exciting, but I don't really know where to get started. And that's where the stories, that's where examples of other pharmacists, that are doing certain things. And folks can say, oh, I'm a pharmacist in that setting. This has given me an idea of how I might also be able to monetize the work that I'm doing, or at least one place to get started. So really well done. I think the introduction was brilliant, the way that you wrote that, and then covering the business model, the Pharmfluencer business models you mentioned, and then followed up with over 30 different pharmacist entrepreneurs that are featured. One of the things that you talk about in the book, and I want to dive a little bit deeper here as it relates to your own journey, as well as maybe what you saw as a theme or thread among those that were featured, is the concept of the power of mindset. And this has come up as a recurring theme of guests on this show. And I want to just hear from you, Kimber, as you put together these 30 plus stories. Tell us more about the theme that you saw around mindset and why it was so influential in their own businesses and journeys.
Absolutely. It is, it's so important. And, I'm going to, forget some of the great quotes on this topic, but, if, what you think, is what's going to come to fruition. And it's so important, both with, when we're working as well as if we're thinking about being an entrepreneur, because it definitely can be very scary. And it's important that we think positive, we think boldly. Definitely, you mentioned abundance, a mindset before, that's where we need to be in this kind of a blue ocean mentality rather than red ocean. And there's a book about that where, again, there's so many needs and opportunities, and there is space and need for everybody. And we need to find that versus thinking that, we're all fighting for that same piece of the pie. And it's more of that restriction. So I focus on it here in the book, definitely when I'm coaching people, as well as in my courses, how important that is. And I, always try to support developing that and focusing on having a positive mindset. And a critical way to develop that mindset is surrounding yourself with like-minded people. So it's important when you're considering this journey that you do talk to people who have been there and done it, because it's easy. And, I definitely experienced this in my family. When you start talking about entrepreneurship and it's like, oh, you're going to leave your nice, solid pharmacist paycheck to do something that's this risky. Really? Do you want to do that? And it's, being around, with other people. And when I was actually at a retreat and everybody's like, well, Kimber, you need to give your notice. Like, you need to do this now. Like, as soon as you get back from this retreat, like, give your notice. I'm like, well, let me, and I was, I knew I was going to leave within a couple of years, and I didn't want to leave right then because it was Pharmacist month. But soon after that, I did make the decision, and it was surrounding myself with these like-minded folks that helped me with my mindset about this, that, I would be successful, and to think about it. And I do think one of the quotes I do have in the book is that it did say that, destiny is not a matter of chance. It is a matter of choice. It is not a thing to be waited for. It is a thing to be achieved. And I think, those are, quotes and mantras that I try to think about and repeat that help me with my mindset, as well as, like I said, surrounding myself with these wonderful Pharmfluencers like yourself to motivate me, as well as sometimes commiserate. So, we can have that positive mindset, but that doesn't mean that bad things won't happen. It is more about how we approach it and how we react to it. That is the key part of the mindset, and not just, having that grit and resilience to move through any troubles that come up.
Yeah. And Kimber, there's something really powerful you said in the introduction that I think gives people a sneak peek into your mindset and kind of the motivation behind your work. And that was when you said there's something empowering about taking hold of one's life and sharing that narrative with the world. And I think for folks that, have an idea and want to create something and want to do something, don't underestimate, the power that can come from that shift in mindset when you're creating, you're putting yourself out there. Yes, there's fear. Yes, there's risks that's involved. But that's a beautiful thing when you start to see that you're producing something that's having a positive impact in other people's lives. Kimber, I have a follow-up on that. In addition to surrounding yourself with like-minded people, so important, and there's lots of different ways that folks can do that. You've created, community that helps that as well. Are there one or two other things that you have found either personally or, in coaching others? I'm thinking of things like could be morning routines or just, a voracious hunger to be reading and learning. But are there one or two themes that you have found individually or in coaching others that really help in this shaping of mindset?
Yes, I mean, a lot of the things you mentioned are definitely, important. So that's why in the book, I know I refer to it as kind of having your inner circle and your network, so
Mm-hmm.
that is around that kind of, creating those connections. But I do think that continuous development is an important part of that. So, having a professional development plan that not only includes your subject matter expertise, but now also aspects of entrepreneurship. And
Mm-hmm.
you don't have to learn and know every aspect of it, because you can definitely hire and, pay other people to do certain things. But, expanding your development so that you are considering, and learning, right? This is now your business. So you
Mm-hmm.
do need to spend some extra time and investment in that. And, definitely having a coach, I would say, is probably the most important thing I have done for mindset through the years. So again, whether I had what I used to maybe refer to as like an executive coach,
Mm-hmm.
maybe at one point a career coach, and then more of an executive coach when I was in leadership positions, to now having a business coach. I think having a coach is critical. There's 4 levels that I actually think about in terms of relationships. The first one is just networking. So you're like kind of level 1 relationship building is like networking. So everybody should have a networking plan and be strategic about it. And then people should have a mentor, somebody
Mm-hmm.
that's more that you do meet with, that's within an area that's related to your development. People should have a sponsor if they're in an organization. So that's like kind of the third level. And a sponsor differs from a mentor usually because they're in a position of power and they can sponsor and advocate for you, like when certain positions come up. And then the fourth level of that relationship area that is critical is coaching. And some of the training I've done on coaching calls your coach like your paid best friend, but it is somebody who will challenge you beyond what you would maybe challenge yourself to do,
Yep.
but also see things in you that you may suppress or not be willing to acknowledge and bring out,
Mm-hmm.
and move you through your fears to success. So I would say, again, definitely just having that inner circle related to your networking and your mentors, doing your development, but then ultimately having a coach has been what's been so important for me with my mindset.
Yeah, well said. I would agree with that too. It took me a while to get around to the importance of making that investment of both time and money, but it's so important. And I would just echo everything you said in terms of, when I think about the impact that my coach has had on my overall mindset. And it's not just in those coaching sessions, right? I think when done well and when you are ready for the coaching, it's the constant thought and dialogue that's going on. It could be internally, it could be after a coaching session, my wife, Jess, and I, or a friend, we're kind of digesting and following up on things, but it's a continuous process, that's ongoing. And it's really, really fun to kind of think about like, what's the next level? What's the next level? Like where else can I continue to grow and stretch myself? And often that means perhaps going into, some areas that are uncomfortable as well.
It's sometimes what my coach has also done is in a way the opposite. Like it's also a matter of making sure I do have balance and that,
Yes. Mm-hmm.
it is a business. There's a reason, like you said, about what you talk to your clients about is, what is your goal here? Well, it's not in most cases to work more hours than you are working at the pharmacy, but it is for some more freedom. And maybe that's not something that you
Mm-hmm.
expect maybe in your first few years of business, but I know my coach also helps me with that to be realistic as well in terms of, am I prioritizing the most, critical things and ensuring that I don't
Mm-hmm.
burn out or put too many things on my plate, or also, definitely challenge me to make sure I'm outsourcing things if it is definitely things that I can
Mm-hmm.
delegate. So definitely, thinking new and balancing comes from a great coach.
Speaking of outsourcing, you talk about in the book that your biggest learning curve was being the transition from a solopreneur to hiring and filling positions, which I was surprised at given, your background in managing and leading teams. And I would assume very, very comfortable with delegation, which may not always be the case for folks. So talk to us more about why this was such a steep learning curve for you.
It is a good question. And I still, to this day, I think I still have some trouble with it. And I don't know why, right? Like you said, I've hired, hundreds of people. I've had, teams of, hundreds of people under me through a matrix organization. And it was, when you're using your own money, I guess, and you're kind of, I guess, in like some people like bootstrapping. I didn't like take loans, the expenses, for those first few years as a side hustle, I was losing money, technically based on, the investments I was making in my education, the website, some things. And because it was on the side, I wasn't like bringing in a profit. And so you think like hiring is just gonna mean more expense. But at the end of the day, and as I've learned from more entrepreneurs, the faster you can scale up through working with others, that will usually get you to the finish line faster and to become, more profitable. And I did have trouble, seeing that early on. And then interestingly, even when I was hiring, it was easier definitely to hire for like specific tasks. Like if I needed a graphic designer, I needed a video editor,
right?
Those things seemed easier to hire for. And then I definitely had a mindset around my assistant, again, where I was doing things myself and then hiring an assistant for 10 hours a week or 20 hours a week. And it wasn't until I did take a course actually on virtual assistants. It's like, how can you scale yourself, right?
Yes.
And then, put yourself as the CEO. Like literally, that's what they called this course that I took. It was like, you're the CEO of your business. You would not be the ones posting certain things, or, you would not be the one to create a web page. That would be somebody else if you were the true CEO of your business. And thinking through that and moving to actually hiring somebody full time, where, just like I do talk about in our profession, you should be practicing at the top of your license. You should do the same in your business. So unless it's something you absolutely are uniquely qualified and only you can do it, then you should be able to delegate or outsource that. But it is interesting where I feel like I still was not doing a great job, was even on the hiring process. I was trying to work and wanted to just hire different agencies who would get me an assistant. And I'm like, I have hired lots of people, right? Why haven't I converted to do that myself? So once I switched and did that, and I actually hired myself, and same thing I'm doing now with looking for subcontractor consultants, is I can do the interview the same way I did before. I don't know why I was treating it differently. There are definitely a lot of things that should cross over from intrapreneurship to entrepreneurship that for whatever reason I had a mental block about. But that is cleared now, and moving more focused into, making sure that it is a true business, and I'm hiring a team just like I would have done when I was the chief pharmacy officer.
Great stuff, Kimber. And I think that first one is, very difficult. And, I think as time goes on, it becomes a little bit easier as well, but appreciate the reflection. I would encourage, again, folks to make sure they pick up a copy of Pharmfluencers, the inspiring stories of pharmacy entrepreneurs, over 30 pharmacy influencer entrepreneur stories. You can pick that up on Amazon, or you can also pick that up by going to kimberboothe.com. Kimber, what's the best place that folks can go to learn more about you and to follow your journey?
Yeah, definitely coming to my website at kimberboothe.com. They can learn a little bit more about me. And if you go to kimberboothe.com/links, you can get access to my various social media channels, as well as get the free Pharmovator score to see what kind of a pharmacy innovator you are, and basically just get on my email list so I can, communicate with you more regularly when these different opportunities come up. So basically go to my website, kimberboothe.com, or kimberboothe.com/links to get to all of my contact points.
Great. We'll link to the website as well as LinkedIn and the books. We'll link to all that in the show notes. So Kimber, congratulations on, again, the new book, your second book, the work that you're doing, the impact that you're having on the profession. Look forward to following your journey. And thank you so much for coming on the show.
Thank you, Tim. Thanks for having me.
Before we wrap up today's show, let's hear an important message from our sponsor, Insuring Income. If you are in the market to add own occupation disability insurance, term life insurance, or both, Insuring Income would love to be your resource. Ensuring Income has relationships with all of the high-quality disability insurance and life insurance carriers you should be considering and can help you design coverage to best protect you and your family. Head over to insuringincome.com/your financial pharmacist or click on their link in the show notes to request quotes, ask a question, or start down your own path of learning more about this necessary protection. As we conclude this week's podcast, an important reminder that the content on this show is provided to you for informational purposes only and is not intended to provide and should not be relied on for investment or any other advice. Information in the podcast and corresponding materials should not be construed as a solicitation or offer to buy or sell any investment or related financial products. We urge listeners to consult with a financial advisor with respect to any investment. Furthermore, the information contained in our archived newsletters, blog posts, and podcasts is not updated and may not be accurate at the time you listen to it on the podcast. Opinions and analyses expressed herein are solely those of your financial pharmacist unless otherwise noted, and constitute judgments as of the dates published. Such information may contain forward-looking statements which are not intended to be guarantees of future events. Actual results could differ materially from those anticipated in the forward-looking statements. For more information, please visit yourfinancialpharmacist.com/disclaimer. Thank you again for your support of the Your Financial Pharmacist podcast. Have a great rest of your week.